So very good morning to all. At the outset, none of the authors have any financial disclosures in the study. So we do know that keratoconus is a progressive inflammatory corneal ectatic disorder which is characterized by central corneal thinning, protrusion, and loss of visual acuity. We do come across some patients like, when you've seen them some 15 years back, they're absolutely normal, but over the time they keep progressing. And even if you have done a cross-linking from them, for them, they still progress. We do not know that why this still happens, and what are the changes which are happening. So our group has published that the feed forward mechanism starts right from the beginning, which includes the environmental insults, the injury, the eye rubbing, hormonal imbalance, and also some inflammatory factors. The inflammatory factors can be MMP9s, other cytokines, chemokines, and secreted molecules, which can alter your altered keratocyte functions or density. And also, it can reduce the collagen synthesis by increasing the MMP9 and reducing the extracellular matrix turnover. And this is just a loop feed forward mechanism which leads to the keratoconus disease and the progression of the disease. Now, MMP9 is known that it is increased in the keratoconic eyes compared to that of controls, and it keeps increasing with increasing grade of keratoconus, and that can lead to reduction in the collagen activity. Now, LOX is something which is extremely important. It holds the collagen fibers into place, but is lower, then the collagen fibrils which are here, they start slipping away, and then that's how your keratoconus disease progresses. So we have published in the past that if the MMP9 levels are higher in the keratoconic eyes, the lysyl oxidase might be lower in the keratoconic eyes, and the levels of lysyl oxidase reduces with increasing grades of keratoconus. And if the lysyl oxidases are lower to begin with, and you have done a cross-linking for these patients, the post-cross-linking outcomes might be suboptimal for the patients who have lower lysyl oxidase to begin with, rather than the patients who have optimal lysyl oxidase to begin with. So MMP9 and lysyl oxidase are very important in a keratoconic disease when you are keeping them under observation, or you've done a cross-linking, or you're going to observe them post-cross-linking. And this is a study which is done on the human corneal epithelial cell line, that if the MMP9 level, which is the inflammatory markers, is on the higher side, then it reduces your lysyl oxidase. The collagen fibrils start slipping away, and it also reduces the levels of the collagen fibrils, and that makes your cornea weaker, and the weakness keeps increasing with time. So what happens here? It is nothing but any inflammatory factors, they act on the collagen fibrils, and the MMP9 actually breaks the it reduces the lysyl oxidase, it breaks the bonding between the collagen fibrils, and that is how your disease happens. So it is very important that we actually treat the disease at the molecular level and treat the inflammatory markers. And this inflammatory markers actually increases because of the oxidative stress to begin with. So is there an impact of eye rubbing and inflammation on the cornea? And can we have the novel therapeutic agents which can negate the MMP9 actions at the molecular level and also upregulate LOX effect at the same time? We divided our study into two phases. One was the animal model study, and the second is the in vitro model study. In the we took the cotton swab to rub their eyes, and the rubbing was with this cotton swab on the eyelid when the eyes were closed in a forward and backward mechanism, like how just the patients do it 12 times each day to replicate the same model of a patient eye rubbing. And on top of it, we added some inflammatory molecule to induce inflammation, and for 7 days. This is how it just looked like in our lab. On inducing eye rubbing, this is how the mice rubs the eyes, and this was done for continuously 7 days. And after 7 days of treatment with eye rubbing and the inflammatory molecules, the corneas were harvested after enucleation, and immunofluorescence and gene expression studies was done for them. What we observed was that this is the control eyes. This is the red color indicates the eye rubbing, the green color indicates the induction of the inflammation, and the purple color is the eye rubbing plus. Is that compared to controls, when the mice, we all know here that eye rubbing can lead to progression of the disease, which was proven here. But on induction of inflammation, even if the patient don't have eye rubbing, but even if they just have inflammation in the eye to begin with, then also it makes your corneas excessively weaker by reducing the collagen levels, by reducing the lysyl oxidase activity, and by increasing the MMP9 levels. So eye rubbing, yes, is a factor, but inflammation alone can lead to increase in the MMP9 levels and the reduction in the lysyl oxidase and the collagen A1 levels. So was this like the same in the in vitro model, which is the human corneal epithelial cell lines and the human corneal fibroblast? Yes, on inducing inflammation on the human corneal epithelial cell lines for same 7 days, we observe the same thing, that on chronic inflammation, the lysyl oxidase activity does reduce and the MMP9 activity does increase. So that suggests. So the next question is, we now know that it's established that inflammation can reduce lysyl oxidase activity and the collagen fibers, but can we have a novel therapeutic for the same? Our group has published in the past that there is a role of trehalose which augments the autophagy to mitigate stress, and it reduces the inflammation on the human corneal cells in dry eye patients. So we took the same molecule and we also took the batimostat, which is known to reduce the MMP9 expression and also its activity along the inflammatory signaling molecule. And along with that, we also tried the trehalose because it's known to inhibit inflammation and also promote the autophagy as well. The same experiment was replicated. And in addition to the eye rubbing model and the inflammatory model, we added the batimostat, the trehalose, and the combination of batimostat and trehalose. And what we found out was that the batimostat and trehalose significantly reduces the MMP9. The effect of individual trehalose and batimostat and the combination of batimostat and trehalose was similar, but if you use a combination of batimostat and trehalose, the effect was much more than just the individual batimostat and trehalose. And the same was observed in the human corneal epithelium cell line also. Here the blue color indicates the lysyl oxidase, which is the control. The TNF alpha induces the inflammation, and you can see here the lysyl oxidase activity has reduced. These are the control eyes, but if you treat them with trehalose or batimostat or a combination of trehalose and batimostat, in this inflamed eyes, the lysyl oxidase activity actually increases, and the combination here increases the lysyl oxidase activity much more compared, and it reduces the inflammation as well compared to that of control eyes. And this is a similar study. Treating them with batimostat and trehalose actually reduces the loss of TNF alpha induced reduction in LOX activity, and it also reduces the MMP9 levels. And this is a collagen contraction assay model, which actually, if you see, this is the control and this is the keratoconic human corneal fibroblast. If you can see here in the periphery, you can't see the reflection to be that dense. So that means the collagen is extremely weaker, but if you treat them with batimostat, trehalose, or a combination of it, the collagen actually starts contracting. That means that if you put them in the human cornea, it will work as good as a cross-linking effect. It will reduce their inflammation, increase the LOX activity and the collagen activity for the same. So yes, it does block the disease at the molecular level, but the challenge will be that we need to measure the molecular markers to begin with, and we need a diagnostic how we can do it in our clinics, and the next step is going to be clinical trials and the regulatory approvals. So human corneal cells exhibit decrease in the ECM matrix protein and increase in the MMP9 under inflammatory stress, but trehalose and batimostat can de-repress the LOX levels in vitro, ex vivo, and in vivo in human donor lenticules, corneal cells, and mice model. Thank you.